in listen-only mode.
Welcome to the American Indian and Alaska Native Behavioral Health webinar series presented by the National American Indian and Alaska Native Addiction Technology Transfer Center. I'm Kate Trams and I will be administering today's webinar. Today, Dr. Dolores Bigfoot and Dr. Anthony Stately will be presenting Dancing Along the Fringe, Managing Ethical Dilemmas and Clinical Issues in Substance Abuse Counseling with Tribal Communities. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. The National American Indian and Alaska Native ATTC is one of 4 national focus centers which serves the ATTC network. The ATTC network is a nationwide network made up of 10 regional centers, 4 national focus centers, and a network coordinating office. The map on this slide shows the states served by each of the regional ATTCs. To learn more about our center, the network, or your regional center, please visit our website. Our next webinar in this series is scheduled for Wednesday, October 2, where Peter Nathan will be presenting from DSM-4 to DSM-5, Significant Changes for Substance Abuse Professionals. In addition to this webinar series, we also offer another series titled the Essential Substance Abuse Skills Webinar Series, which provides an overview of competencies from CSAT's TAP 21 publication, Addiction Counseling Competencies. The next session in our Essential Substance Abuse series will be held on September 18 from 1 to 2:30 Eastern Time, where Bob Rarrett will present on Professional Readiness, Attitudes, and Values. For more information on our webinar series, you can contact Karen Summers at the email address or phone number provided on this slide. Our center is a NAADAC certified educational provider, and we're happy to provide you with CEUs. The cost is $10 to do so. The CEU request form, along with a copy of the PowerPoint, will be sent to you within 24 hours of today's session. If you don't receive the email with handouts within 2 business days, please contact Karen Summers using the information provided. In addition to the PowerPoint handout and CEU request form, a consent form and information about participation in our GIPRA evaluation will be attached to the email you receive following today's webinar. We ask that you fill out the consent form and return it either by email or fax. If you agree to complete our evaluation, you will receive a link inviting you to participate in a brief online customer survey. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. GIPRA stands for the Government Performance and Results Act, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. SAMHSA uses information collected by these surveys to determine how many people have attended our events, your satisfaction with our events, and how useful our events are to you. We hope you will assist us in gathering information about our services by participating in our evaluation. Before we start today's session, I'd like to give you a quick overview of the GoToWebinar system. To hide or expand your toolbar at any time, you can click on the red arrow in the top right side of your window. To expand your screen, click the middle button in the top right-hand corner. You will be muted for the duration of this webinar. Please use the question chat box to share your questions and comments. Your questions will only be visible to me, the webinar moderator. I will pass your questions along to the presenter at appropriate points in the presentation. We also would like you to be aware that this webinar records participation attention time. If you minimize the webinar or are working in another window, the system will record your participation as inactive, which may be reflected in the number of CEUs received. The opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of CSAT, SAMHSA, or the U.S. Department of Health and Human Services. Today's webinar is presented by Dr. Dolores Bigfoot and Dr. Anthony Stately. Please join me in welcoming both Dr. Dolores Bigfoot and Dr. Anthony Stately.
Hello, This is Dee Bigfoot. I'm with the University of Oklahoma Health Sciences Center, and Tony Stately and I will be presenting this session of this webinar series. And I have to share that this is a training that Tony and I have presented to the Indian Health Service and ATTC a couple of times. It is a day-long training that we have condensed down to about 44 slides or so. So you're getting information that we usually take a lot more time in explaining. We wanted to give you several much more slides than what we're actually going to be able to cover. We're also going to be jumping around on our slides a little bit. Tony and I are going to be going back and forth on the presentation. We have a lot of information about the general ethical guidelines. There's not a lot specifically written about ethical guidelines for tribal communities. So this is something that that's evolving as we're talking about this particular, as we work in this particular area and the training that we're doing. So we'll start with, and I hope you bear with me, there's a couple of other disclosures. I just got a new program and I'm not real comfortable with using it yet, so if I err, please be patient with me. As we look at the issues that we need to consider in terms of ethics, some of the questions we need to consider is just, what are ethics? What are our personal ethics? How do we define that? And are ethics the same as law? Does it mean that if you violate an ethical principle, is that unlawful? Are there penalties that are there? Why or why not are they law? Are they arbitrary? Does someone just make them up? Or have they been designed because of very thoughtful or meaningful dialogues? Do we tell people why they can't do certain things professionally? Are we supposed to police ourselves as professionals? Are ethics in terms of principles enforceable? And who is the individual that's supposed to be the one that enforces them? So are these standards enforceable? And again, self-governance, is that effective, efficient? Is it equitable? And is the understanding that we have about how we're supposed to behave toward one another, are there assumptions underlying that makes it easier or acceptable in all of our situations that we encounter as professionals? As we consider this, what we want to do is to have a broader picture. So this is from Help for the Helpers, and it's we counselors have a lot of power. And I think that's an understanding that we need to have, is the power that we present as we are in situations where we are supposed to be supportive and helping of others. As authorities on this terrible disease of addiction, let us be careful to never use power for petty or vindictive ends, to never thoughtlessly reject a client. We can affirm our client's sense of value, or we can damage them with a casual joke or comment at their expense. We can help them to respect themselves, or we can tear down their self-esteem by treating them disrespectfully and unimportant. We have the power to do good or great harm. Today, let me remember my power and take care to use it wisely. So as we consider what it is that we're offering as our expertise to others, do we always look through this lens to do good and to not do harm? So as we understand the broader context of how to be a professional, how to use ethics, we need to recognize that things are not in isolation, that our clients come to us with a background of multiple kinds of considerations, and as we look at our tribal communities, that's not only the individual, it's their family, it's their tribal community, it's their tribal nation, and within that, how that is within the greater context of being a citizen of the United States and what that implies. So psychology, counseling, and other helping professions are representative of a broader system that has perpetrated significant harm upon indigenous people. So as we look at that historically and as we look at things contemporarily, so as we consider what our role is, then this broader context needs to be considered. So as practitioners, we must acknowledge the collective and cumulative emotional wounding that has resulted from historically these traumatic events and what that means in terms of colonization, and that this lens should always be there. We can't separate a person's history when they come into our settings. And I think the other part is that as we think about the ethical standards that have been delivered, the assumption of one-on-one relationships, that is what that is how this framework evolved, is a one-on-one relationship. But as we look at our tribal communities, relationships with many people is very important.
Dr. Bigfoot, I hate to interrupt, but I wanted to just let you know we aren't currently seeing your screen.
Oh, really?
Yes.
Okay.
So
what do I?
If you just go to the webinar toolbar and then click that that blue button with the play, we should be able to see your screen. There we go.
Oh, well. Oh, okay. Well, in that case, let me go back. I told you I was in sad shape here with the new. So how do I? Okay, let me.
Thank you so much.
So these are the questions that I started off with. This is the quote from Help for the Helpers. This is understanding the broader context of practice and what it means to be thoughtful as a helper. And then I'm turning the time over to Tony, and he'll talk about the foundation in terms of historical trauma.
Thank you, Dee. So really quickly, I'm assuming that many of you have probably already participated in a number of trainings that have addressed the issue of historical trauma. My guess is that many of you as practitioners have already heard about historical trauma. So I'm not going to spend a lot of time talking about it, but I think it is an important thing to discuss in terms of studying the broader context. So I'm just going to kind of go over it briefly. So historical trauma has been defined as, or historical trauma, one of the elements of historical trauma is the notion of historically traumatic events that have been perpetrated on tribal communities over a number of generations or a number of years. And these events were things and incidents that were communally based that caused tremendous upheavals or high levels of community distress among and within indigenous populations. Events that were specifically planned by the government, phenomenon that was either planned specifically by the government or government-sponsored institutions such as the boarding schools and other genocidal practices and policies, resulting in a cumulative and a collective emotional wounding that we have seen and tribal communities, we've been talking about this sort of like this resultant multi-generational or intergenerational transmission of grief and emotional wounding from one generation to the next. Maria Yellowhorse Braveheart, who is a friend and a colleague, and a number of other people have talked about how this trauma is held personally and collectively and transmitted over generations, such that individuals who may not necessarily have actually gone through a boarding school experience or other traumatic events will still be dealing with the effects of those traumatic events, even though they necessarily haven't been directly exposed to those traumatic experiences. Here's a conceptual model, and it's actually a model that I distilled from a much more busier table from an article called A Conceptual Model of Historical Trauma by Sotero in 2006. I should have had that citation on the slide, I apologize, but that citation is Sotero, S-O-T-E-R-O, 2006, from the Journal of Health Disparities Research and Practice. It's a good article, and it helps you to understand just basically in a real fundamental way how we understand the impact of mass traumatic experiences that have been sort of perpetrated from a dominant group toward the subjugated population. In this context, we're talking about American Indian and Alaska Native populations within the continental United States, and how that transmission process happens over time. Go ahead. I think one of the other things that we have to think about when we think about the broader context is also the ongoing traumatic experiences, are the more contemporary sort of experiences that Native people have, and the impact that that has on our psychological, emotional, spiritual, and physical well-being. And here you have a slide that sort of shows all kinds of ongoing traumatic experiences. And I think one of the things we don't talk a lot about in behavioral health is the impact of racism or microaggressions. What Gerald Wing Sue sort of kind of wrote about a number of years ago, which is really a conversation around the various levels in which overt and covert discriminatory experiences are perpetrated upon people of color, and in this case specifically Native people. So microaggressions are those chronic daily assaults and attacks and injustices that we as people of color endure in the form of interpersonal behaviors, environmental messages, such as from the television, emails, those kinds of things, that are denigrating, demeaning, and invalidate us. And they take an emotional and psychological toll for sure, and I say arguably also a physical and spiritual toll as well on the individual and the group. So, okay. So what do microaggressions look like? Well, it looks like these kinds of things. The images that are prevalent out there and the conversations that are prevalent out in society about who Native people are, what we believe in, how we behave, how we conduct ourselves, how we form our relationships, what are the things that are important to us. And then last but not least, this bumper sticker that's at the bottom is from where I'm from in the Midwest. This is a prominent bumper sticker that was very prevalent in the last 15 years or so in response to the struggle and the conflict that was going on in this area around fishing rights. And these kinds of conversations communicate a message to Native people and to the broader society about the value of Native people. And I think those are important things to be thinking about in terms of its implications for assessment and treatment, but also how we think about the behavioral health issues that we see tribal people coming to see us for. I think when we think about assessment and treatment, we need to remember all of these things, and that, like Dee was saying, that we need to be thinking about things like the importance of extended family, the organization of the family in the tribal group and the community, the prevalent cultural values, norms, and values, and all of those things. We need to be thinking about what's out in the community in terms of being able to support people in their healing journeys and those kinds of things. And absolutely consultation with traditional healing and Western healers in an integrated approach would be probably very, very wise. Okay. Dee, passing it back to you.
Okay. And we're going to talk a little bit about ethical standards in counseling practice, and to cover some of the professional standards from the organizations that have looked at this and presented us with these guidelines. So as we look at the ethical standards, you know, one of the things we have to think about is the reason why we encounter ethical standards is because of our relationships with each other. Not only, I think we think of it in terms of the helper, the client, or the professional, and the client or the consumer, but it's also our co-workers. We're in tribal communities. We have different kind of relationships with, especially in small communities where, you know, not only relatives, but you know, people we encounter at the store, people we encounter in terms of, you know, different kinds of purchases or you know, cultural items. And so when we think about the potential for these encounters, this is where we're trying to maneuver what would be those things that would be not only not creating harm, but doing good, and that we don't let some of these microaggressive kinds of impacts and influences shift us as we are in these situations. So as we think about these standards, it's what do we do on a consistent basis so that we can maintain these relationships that are much more helpful. So what we look at in terms of looking at those ethical issues, what are they? Looking at the competency level. So are we doing all that we can to deliver the best of care, and are we looking at you know, evidence-based practices that we know are the most effective, or are we not giving the most effective care, and that, you know, people come to us for assistance, and do we provide them with the best assistance possible? These human relations, how we relate to one another, what are all the different kinds of relationships that we have within our community. And sometimes for some people, you know, it's only a work relationship. Others, it's much more extensive. What does it mean in terms of privacy and confidentiality? How do we maintain that? And when we talk to a lot of our tribal communities, these are the kinds of issues that we encounter. You know, how do we maintain privacy when tribal leadership is questioning us about certain families? How do we explain confidentiality and maintain that standard? There's other things in terms of advertising, record keeping, education, research, assessment, and therapy. So these are the areas that most guidelines want to address. There are different codes or different standards, different principles coming from different associations. So this is the Association for Addictive Professionals, and you have the website. I'm sure that you're very familiar with this. And then it provides, if you look at the website, it provides a lot of information. And I think that when we ask people, you know, how often do you go to your professional ethics codes, and is this something that you use on a regular basis? Is it something that you read up on a frequently? Is it something that you consult with? And what everyone should be aware of is where to locate it at. And as you're engaged in this therapeutic exchange that's going on, that you always be aware of what codes you are maintaining. We have several, the American Counselor Association, this is their website. It's in terms of what it means for a particular association to develop codes, and what are their philosophy that drives it. And so it says professional values are an important way of living out an ethical commitment. Values inform principles. Inherently held values that guide our behaviors or exceed prescribed behaviors are deeply ingrained in the counselor and develop out of personal dedication rather than the mandated requirement of external organization. So as we look at what is inherent in us, what is it that we value, and how do we want to portray that, not only in our professional lives but in our personal lives. We have the National Association of Social Workers. The nice part about this is that all of these are readily available on websites and easily accessible. We have the APA, American Psychological Association, 5 General Principles, and what that means in terms of benevolence and striving to benefit and do no harm. So it's not just that we want to do no harm, it's just that we also want to do good. And the relationships of trust, the awareness of professional scientific responsibilities to society and to specific communities. And when we think about specific communities, those can have flexible parameters. In our tribal communities, we have the community in terms of the geographical area, but we also have the community in terms of the nation, the tribal nation, and all members of that particular tribe. But then we also have people who are married in or associated in other ways that are of maybe tribal members, or even those that are eligible for membership or maybe have a conflict because of disenrollment. And so as we think about what it means in terms of specific communities, there could be a wide variety of ways that this parameter has flexibility and is fluid in encompassing what a specific community may be. We always want to maintain integrity. We talk a lot about what it means to have integrity as a professional, as a individual. And so when we look at this, it's seeking to promote accuracy, honesty, and truthfulness in the science. So this is looking at things that are effective in the teaching and in the practice. So I'm not going to go through all of this, but as we consider what this means, this is a constant reminder. This is self-reflection. It's also, as we work in our different settings, that we use this as a gauge as to how we are meeting those. We look at various aspects of these standards. And so there are considerations when making ethical decisions. Well, as I said, we have a lot of slides, many more slides than what we're actually able to go through individually. But you'll be able to request the slides and have access to them. Of course, all of this is from various websites, so there are available in different forms. But as we think about these specific standards that we want to look at, in terms of autonomy, do we assist others in recognizing the freedom to choose and the ability to make decisions about their own destiny? So there's autonomy, there's obedience, and we're look at how obedience and how independence and autonomy all come together. And it is a wonderful dance. We talk about dancing along the fringe. And so as we think about obedience to legal and ethical directives, what do we reach for in terms of being able to recognize what it is that we want to maintain? Being conscientious in terms of refusing to carry out things that are illegal or unethical, and recognizing what is unethical. There's a lot of things being played out in the media with individuals taking gifts. There's, different things that people have, sexual harassment and different kinds of things that are examples of questionable behavior. And when we think about our tribal communities, gift giving is that exchange that allows a lot of the relationships to be built. And so when we think about what is it and how do we refuse, and what does it mean when somebody is sincere in giving something, and we're looking at, is this ethical or not? Is this really something that I should be a receiver of? Benevolence, we really want to be able to help others to really make a difference in their quality of life. So as we think about what this all means, gratitude, competency, justice, fair and equal treatment, stewardship. So as we think about this, we're going to see a lot of similar or repetitious values in all of the codes that we're looking at, wherever which particular national association that they may be reflective of. And so we're going to see that there's some overlap, and that this is our way of looking and being self-reflective. I'm not going to go through all of these, but again, I just want to make sure that we recognize that the interests of the client to do no harm, and then equally important is the self-interest, to protect self and protect personal interest, and how this balance is, again, the stance, drawing on those personal values and professional values. So why are ethical principles and codes necessary? Tony, do you want to take over?
Sure. I think so one of the things I think is a really important thing for us to always consider and remember is that the counseling and the therapeutic relationship between us and our as professionals and our clients, that relationship is an unbalanced relationship. We often hold much more power and privilege as a therapist and a counselor than the client does, and that we need to be we need to remember that. And the ethical principles and the codes are sort of there to sort of help us have a set of guidelines that helps us navigate that unbalanced relationship, and to remember, to help us to define that playing field. The counseling and therapeutic relationship is complicated by nature, so the client's issues and problems are very complex usually, and the nature of our relationships itself is very complicated, and we see that in sort of like I was going to say, quote-unquote, the garden variety sort of like clinical relationship, as if there is one. But within tribal communities, I think we see that really much more commonly, this real sort of kind of intricate, tangled sort of threads of relationships and lines of communication and those kinds of things. And the therapeutic relationships in tribal communities can be very, very complex and very, very confusing. And so having a set of guidelines really helps us to sort of like tease that out and untangle that and help us to sort of kind of provide us a framework for thinking through how we do our work in a responsible and ethical manner. Therapy is characterized by abrupt changes which have severe implications for clients' well-being, and that's a really fundamental thing to remember. And then I think one of the most important things is for us to remember that as therapists and counselors, we're human, and by our very nature of being human, we are prone to make mistakes. We're fallible by nature. And having ethical guidelines and codes provides us like a framework for holding ourselves accountable and also providing us a set of guidance for doing the work that we do. I think one of the things, but I think some of the common things that we see oftentimes in ethical issues, and if you just sort of like did a Google search or you just sort of like called the literature and looked at like what are some of the common ethical issues that affect clinical practice, you know, there's a whole litany of things, but they sort of kind of cluster around some primary things, and those are all kinds of common themes emerge from the literature. But I think one of the things we don't typically think about is like, what do these things look like in tribal communities, and how do they look differently in tribal communities, and then how do we apply the actual ethical standards to the practice of navigating those ethical quandaries within tribal communities when it's not so clear, or there hasn't been literature written about it. So here's some common ethical issues that affect practice. Usually the therapist-counselor competence, issues around client welfare and informed consent. How do we ensure that clients understand fully and are completely informed of the tools that we use in counseling, or even the counseling enterprise. Confidentiality, of course, is also another one. And then, of course, dual and multiple relationships, is something that we see oftentimes in tribal communities because of some of the stuff Dr. Bigfoot was talking about. And then, of course, sexual relationships. Most jurisdictions in most states are pretty clear about strongly prohibiting sexual relationships. And in most of those states or jurisdictions, sexual relationships with our clients, either past or present, constitutes a criminal offense. And I'm not really sure exactly how many tribal codes that's written into, but I would say that, in particularly in my community where I work, it's real clear in the tribal code that that's something, a practice that is prohibited. I think also one of the things that we need to think about is, and as a psychologist who's been working and practicing in tribal communities or with tribal people for many, many years now, one of the things that we often see is a common occurrence happening between conflicts between ethical standards and legal standards. And I think when we talk about how we see that function in tribal communities, we'll sometimes see conflicts between ethical standards, legal standards, and then what is the tribal code, or what is the value of the community. And those are all kinds of things that we have to sort of balance in our decision-making processes. So I think with respect to the issue of competence, we often have to sort of kind of ask ourselves, well, who decides what competence is and who defines what that is? And in the broader context, there's some real clear indication in the ethical guidelines around what are key elements of competence. We don't do things, we don't provide services that we're not qualified or trained to provide. We represent ourselves accurately with our right credentials and our proper qualifications. We maintain current knowledge in the field and those kinds of things. And most people, when they think about, like, am I practicing competently or non-competently, most of the time they're sort of kind of worried about this thing about malpractice. So there's a fine relationship between competence and malpractice. Malpractice, by the way, is not an ethical standard or an ethical issue. Malpractice is a legal issue, and it's legally defined. Narrowly defined specifically, you have to actually have done something as a counselor. You have to have failed to provide reasonable care and actually have a resultant injury happen to the client that meets these 4 conditions for the quote-unquote legal standard of malpractice to be applied. But aside from that, I think we also have to ask ourselves, what does competence look like in tribal communities? Is it just having some knowledge and skills, or are there some other things that we need to understand and know and have in our toolkit as well? That perhaps relates to that broader context that we were talking about earlier. Next slide. Informed consent. When we think about informed consent, what is that? Though the literature is very, very clear about what that is, but I think when we think about how that applies to tribal communities, what does it mean for tribal people to understand the costs and the benefits of treatment? So most in terms of the sort of the broader literature, we really think about that in terms of like the financial costs. But for tribal people, some of the things that we have to be able to help them weigh out is the costs and the benefits of, not the financial costs, but maybe some of the other kinds of costs that aren't so obvious to them in terms of seeking and acquiring treatment. If there's any special arrangements that we have with our clients, we're supposed to be very, very clear about those things. We're supposed to be able to be very clear about our own competencies as counselors and therapists. And if we're engaging in a specific treatment or particular modality of counseling or therapy that's experimental in nature, we're supposed to require a full disclosure and explanation of that. And then also, of course, one of the things I'm really very, very a big proponent of, and I tell my staff who work for me, is be very, very clear about the nature of confidentiality in terms of its legal definition, but also I want them to be really, really clear with clients about the limits of confidentiality. And what I tell people to do is I tell people to give people lots of explanations about what those limits look like. Go through different kinds of scenarios. Ask the clients to tell you, here's the exceptions to confidentiality. How do you understand this? And have them explain it back to you so that you're assured as a practitioner that people really understand that concept. And I think that's a really ethically important thing for us to do.
Tony?
Oh, yes.
Tony, I'm going to fast forward the slides to the ethical decision making.
Awesome. Let's go.
Okay. And so this is there, but you can look at that. Let me fast forward.
That's on a time slide.
Self-awareness, yes.
So I think before you sort of kind of move forward on that, I think one of the things that we also have to remember, and Dee, you mentioned this earlier, is that the ethical standards that are written from the sort of like the national sort of like professional standards, those are written from a framework that's really very specific. It comes from a specific worldview that has a set of values that sit behind it, that sort of inform those principles and those standards. And I think one of the things that we have to do as practitioners who work in tribal communities, we also have to sit back and reflect on what are our own personal values and how we interpret those things in terms of the work that we do. And if there's conflict between our set of values and the values of quote-unquote mainstream society, what those things are, and be really, really transparent and clear about what those things are. So, go ahead. I'll let you do this one.
Well, I think we all have to recognize when things don't seem right, and there's always questions of, well, how do I know that this is a problem? I didn't really think that this would present a problem. So I think that our own internal gauge should be just these feelings of discomfort. Well, should I do this? Should I do that? How should I explain this? And so this sense of uncertainty about what it is that is presented to you, or the relationship, or the understanding that client may have. So this feelings of discomfort. So it's like, this just doesn't feel good. So I think that's a real clear indication that seeking consultation or talking to somebody else would be very helpful. As Tony said, it's conflicts with your own personal values or professional values. When you start questioning, oh my goodness, how could this happen? I just don't feel good about this. When there's a dissonance in terms of what you think is important, and as you go over those ethical standards, I think we could all agree that gratitude and all of those things are very important. So when it really separates it out, and you feel like, oh my goodness, this is not a direction that I want to go. And so all of these are indications that there should be you should stop and think, okay, what are my next questions? What are my next steps? How should I deal with this? So fortunately, we have some of that guidelines there. So this is the ethical decision making. It's available. There's a website, and we'll just go over this briefly. Tony?
So we're presenting you with one specific decision-making model that we sort of are using in our training, that we use in our exercises. There's lots of different decision-making models out there. I think you can probably just, Google them and look for them and find one that works for you. I think the most important thing is to just use a ethical decision-making model that you feel comfortable with and that you can apply on a consistent basis, which is the most fundamental thing. So I think the most important thing is always to gather all the relevant information that you need. So defining the dilemma specifically, like what the situation is, who's my client, who are all the relevant stakeholders, what are all the cultural considerations I need to keep in mind, and help you just sort of kind of define what the dilemma is and all these various options. Next slide. Define what the central issue is and what so what is the real critical ethical issue that you're struggling with, and what are your options? And what I tell my staff to do is to list those things out, like actually write them down. Refer back to your professional standards, whatever code of ethical standards you have. Examine the relevant laws and regulations for your jurisdiction, and then also look into your tribal codes if you have any that specifically speak to whatever issue it is that you're looking at. And then look, is there congruence between all of them, or are they in conflict with each other? And that will help you to begin to think through like how to prioritize some of those things. Also, search out ethical scholarship. What does the literature say, or what are some of your other people who are in your sort of professional realm? What have they contended with, and how have they dealt with that specific type of an issue? Consult with your supervisors and colleagues. Ensure that consultation doesn't violate confidentiality first and foremost. Ask these questions of those individuals that you call up. What have I not considered? What do you think of my blind spots are? Is my interpretation of the ethical code or the issues of the laws accurate? Am I missing something? What other resources should I be looking at? Have I adequately considered the ethical principles at hand? And have I considered all responsible alternatives? And last but not least, what I encourage people to do is ask your colleagues or your supervisors, what would you do if you were in my shoes, what would you do to resolve this dilemma, and why? And the reason I ask people to do that, or recommend that people to do that, is because you always remember that at the end of the conversation, you're going to be judged based on like what other people who practice in your specific field would have done in terms of sort of like the barometer for what is quote unquote the community norm. And so if you sort of kind of document that you went through this deliberation process and you actually asked some colleagues like what would they do, I think you'd be putting yourself in a really good place where you can actually pretty much cover just about any ethical quandary that you could confront yourself with. So I think one of the other things that's really difficult, and we've talked about this with other tribal people, and we just had a training a couple of weeks ago, and we talked at length about this, which is the whole process of deliberating and deciding like what you're going to do and considering your options, and then identifying competing values, and then determining the course of action. And I think one of the things that we really see happening in tribal communities often is the challenge of having to practice ethical courage, right? So how hard it is to make tough ethical decisions when, you have a council or you have other sort of systems of power and control that are saying, well, we want you to do this, but it's counter to what's ethical practice. So sometimes what we really have to do is we have to dig down deep as practitioners and draw a line somewhere and say, that's not ethical, and I won't do certain things. And we've talked at different trainings about how to do that I think in a culturally responsive way and in an appropriate way and a real sensitive way as well. And last but not least, inform your supervisor and document, because if you didn't document it in most professional standards, it hasn't happened. So that's one of the things that's critical to do. And last but not least, I think it's really important also for us, after all is said and done, is for us to reflect on the experience. So asking ourselves, did I act in a timely manner? Was I educated about the ethical codes, or do I need to go back and understand them better and read them better? What other resources should I have available to me? Did I utilize consultation and supervision effectively? Did I adequately identify and weigh the competing values that were at hand? Should I or would I have done anything differently? When all is said and done, is there something that I could have done differently or should have done differently? I think is a really critical question for us to ask. And then last but not least, did I like what I did, and how can I pay this knowledge and this learning forward with my other with my colleagues? Like, helping other people to sort of capitalize from my experience so that they make better decisions as well. Go ahead. So here's just a collapse of sort of like ethical decision, that model in a nutshell. And what I like to tell people, next slide, what I like to tell people is to use, if that model is too complex, use a much more simpler ethical decision-making model. So use yourself and your family and people who are important to you as a barometer for making your decisions. So take some perspective, do some perspective taking. If I or your family were on the receiving end of this decision, would you accept it as fair or just? Does it respect the rights of all persons concerned? Does it produce more benefits than harm overall? Is this something that I would be willing to live with, and this decision, could I live with it if it was made public? Can I explain my decision to my spouse or my significant other and to my children and my family, and it be something that I would be proud of? Does it go beyond the moral minimum and reach towards the higher standards of the aspirational goals of most of the ethical standards and codes? So, I think it kind of goes back to that conversation before about, like, lots of the codes are written from the framework of, like, do no harm, and I think, well, we should not be trying to do no harm. We should actually be trying to help people and benefit and help them improve their lives and do benefit. So. And that's our conversation.
Wonderful.
So I think I take.
Oh, go ahead, Dr. Bigfoot.
Oh, I was just going to say I'm turning it over to Kate. So.
Great. Yeah, we have just a few minutes for questions. So if you have any questions, please type them into the question chat box at this time, and we'll pass those on to Drs. Stately and Bigfoot to address. And then I'd also just like to mention, as Dr. Bigfoot and Dr. Stately expressed, this brief. This is a brief summary of a full-day training that they have developed, and they have offered it through the ATTC over the last couple of months. And if you are interested in that, we plan to schedule more of those. And so please contact us if you would like to know when we will be making those available again in the future.
Questions? No.
All right, I don't see any questions at this point. If you have any, please feel free to submit them. It looks like we've got one coming in right now. How do you address microaggressions with clients?
I guess one thing I think of is in two different ways. So would you mean like clients making microaggressive comments towards you as a practitioner?
Right, does the questioner have any follow-up on that? Okay, so it says no on the receiving end.
Oh, on the receiving end? Okay. Well, I think there's a couple of different things that sort of kind of stand out for me. One is I think it's my particular professional orientation and my personal orientation, that one of our responsibilities as a practitioner and somebody who has perhaps more education sometimes than some of our clients is about this kind of stuff and the implications that it has for therapy and counseling and those kinds of things. It sort of asks us to step up and sort of take on more of the burden sometimes of making things more obvious than not. And what I mean by that is, and I've been in this situation in the past recently. In fact, actually, one of the things, I'll give an example. Recently, I was in a counseling session with a non-native person who has been my client for quite a while. He's been sober maybe about 4 or 5 months, and we were having a conversation about something, a specific issue that he was having with respect to his work, and he made the comment, I forget exactly how he said, but he made a reference to like having a powwow, meaning calling a meeting of all of his work staff to sort of kind of get together and discuss this particular issue that was going on in his work setting. Now, this was a non-native client, and I'm clearly a native identified practitioner. I mean, pretty much anybody who comes to see me in this setting knows that I'm a native practitioner. So I sort of just sat back and kind of sat with that comment for a minute. And I think that he sort of kind of picked up through our interaction that my discomfort about the comment, and he looked at me and he says, what did I say? And I said, well, you used the word powwow to connote a meeting of yourself and your colleagues. I said, and he looked at me and he said, was that insensitive? And I said, well, some people probably would feel that that was really insensitive. And so what it did was it opened up this conversation for us to begin to have a conversation about like how other people experience racist or discriminatory comments, and how he might sort of begin to think about, you know, his language, his behavior, all of these other things, because he works in a tribal community and he relates with tribal people. Right? And so it really was a very good opening for us to sort of kind of crack that sort of, you know, door open wider and engage in a much more broader conversation. And I didn't do it, of course, in a way that beat him up. I just sort of used it as a conversation starter. Well, let's talk about, like, you know, some of the other people that you work with who are Native, and you know, how you think that they might feel if you use that comment in their presence. So I think sometimes we can use ourselves as tools as clinicians to sort of kind of start conversations, or as barometers for how people can think about relating with others and addressing those issues in their relationship. Does that make sense?
Great. If Dr. Stately maybe has time to stay for another question, we have one more question that we can address here. And I know Dr. Bigfoot has to leave at this point, but Dr. Stately, if you have time to answer, do either of you have any specific examples of ethical dilemmas with clients where the legal, ethical, and/or tribal codes conflict?
Did you have anything specific you want to say before you leave?
Well, I think sometimes, for example, with I know this one school that has school codes that are the tribal law and order codes, and how that's presenting a real problem for providers, because the school handbook actually has in the codes the law and order charges, the law and order numbers, and so the school is identifying a particular tribal law and order code as a violation. And then those violations have certain consequences associated with them. And so when we look at services in a public school that is governed by tribal law and order codes that are very specific for certain that are violations that have certain consequences with them, and the school, I mean, it has created a real dilemma for the providers, because it conflicts with so much. And rather than have a student handbook that has these guidelines about how students can be responsible, then they're being actually charged with a tribal law and order violation instead. And so yeah, I think unfortunately these are the kinds of situations where when people are thinking about, well, what it is that we want to do, and and it's very punitive. That's the other aspect of it, is that these particular codes are very punitive toward adolescents who make a lot of mistakes. And so I think being more thoughtful about what it is and how we can influence and change, because we're also looking at trying to be more just, and also have an opportunity, especially with adolescents, to be able to learn from their mistakes. But if they get a legal violation, and they have to go to court for something that they did in the school that should be under school jurisdiction, it really makes it difficult.
I have an example of one. That's a great example, Dee. Recently, one of the I had an example that I had to sort of kind of contend with as the director for behavioral health services here. We had a tribal community member who was on probation for a fairly serious violation within the county, which the county that neighbors the community where we live, where the community member lives. And the court case was originally transferred from the county back to tribal court to sort of like allow us to sort of work with the community member to provide restitution, a treatment plan, all of those kinds of things. But probation, the county probation officers were calling my drug and alcohol practitioners and wanting us to release the full medical record, the full chemical health assessment on this particular client. And I said absolutely not. We will release a written report that distills the information and gives the county probation officers a set of recommendations for how we think this client needs to meet certain kinds of outcomes or guidelines post-treatment. Well, that caused this big, huge problem, because the county did was they pushed back and they said, well, we get the chemical health assessments from pretty much just about anybody that we ask them from. And I said, well, that's all fine and well. I said, but we are a tribal government, and we are a tribally owned and operated facility. And CFR 42 is very, very clear about its guidelines around mental health and chemical health disclosures. I don't have to give you anything other than the bare minimum of information for you to make some of your decisions about whether he's meeting his, what he's required to in terms of his probation. And it's a tribal code. It's specifically a value in our tribal community and in our tribal code that we protect the information of the client as much as possible, and partly because the community is very small, and sometimes the information that's contained in perhaps a clinical record has additional information in the clinical record that is about not just the client, but maybe the client's family for some of the extended community members, or the family members in the broader community, and we don't want that information to get out to people who don't have understanding about that, or they don't really need to have it. And so one of the things I did, my role as the director, was I pushed back and I said, I'm absolutely not giving you that information. And I reminded them of our government-to-government relationship as a tribal jurisdiction to a county. And I had a long conversation around sovereignty. And last but not least, I said, it's not my responsibility to do your community policing for you. I'm not going to give you information that implicates this young man. That's your responsibility and the people who work with you to go and get that information for yourself. I'm not providing it for you. So I think sometimes it behooves us as clinicians to sort of draw a real clear line in the sand and say, these are certain things that I feel comfortable doing, and I'm not going to do anything beyond that. So, is that helpful?
Great. I think that's a wonderful example, and thank you so much for both sharing that. I regret that we are out of time for questions at this point, but I would like to thank Dr. Bigfoot and Dr. Staley for sharing their expertise with us today.
One of the things before we end, and I just wanted to let people know this, is when we do this day-long workshop, this actually is pretty much the lion's share of the afternoon conversation that we have, which is we really do it much more workshop style, where we're having people talk about real-world examples of their ethical dilemmas, and we sit around and we sort of kind of use ourselves as a big, huge, I guess, think tank about like how to sort of manage those things and how to sort of help people think through ways of managing those things in a much more comprehensive and culturally responsive way. So I think, of course, you're not going to get the flavor of that within a 1-hour webinar. So if you have the opportunity to come to a day-long training that myself and Dr. Bigfoot hold in your area, I think one of the things that you'd really benefit from is having that workshop-style experience where you really get an opportunity to vet some of these issues in a broader context. So, thank you for your time. I appreciate it.
Yes, thank you so much. Yes, and as Dr. Staley mentioned, if you are interested in the day-long training, please respond to the email that will be going out. We will be sending an email out to everyone who attended this webinar, and feel free to respond to that, letting us know of your interest in that. As well, included in that email, there will be attachments which will include the CEU request form, a PowerPoint handout from today's presentation, and a GIPRA consent form. We appreciate your decision to participate in our GIPRA evaluation, as completion of these forms allows us to show stamps of the number of people served by our webinar. To participate in the GIPRA evaluation, return a signed consent form to our center by email or fax. We hope you'll be able to join us for our next webinar in this series. On October 2, Peter Nathan will be presenting from DSM-4 to DSM-5, Significant Changes for Substance Abuse Professionals. We hope you'll also be able to join us for our next webinar in the Essential Substance Abuse Skills webinar series on September 18, where Bob Brewer will be presenting on professional readiness, attitudes, and values. Thank you so much for your time and participating today. We hope you've enjoyed the session and look forward to hearing your feedback.